Hi everyone, my name is Dr. Jay Puckett. I'm an assistant professor at Michigan State University in the Department of Psychology. My pronouns are they, them.
Hi, my name is Zachary DuBois. My pronouns are he, him. I'm an assistant professor at the University of Oregon in the Department of Anthropology.
Thank you all for joining us today for our poster. We're going to be talking about structural stigma and mental health for trans and gender diverse people across the states of Oregon, Michigan, Nebraska, and Tennessee.
I'll start with a little bit of background for our presentation. In 2021, there have been over 100 bills that have been proposed across the U.S. that aim to restrict the rights of trans and gender diverse people. That includes criminalizing gender-affirming care and institutionalizing a number of other forms of oppression. Now, research has shown that structured stigma, such as these policies, might relate to mental health among sexual minority people, but there's been very limited research in terms of the impacts on transgender and gender diverse people. U.S. states vary significantly regarding the treatment as well as the protections that trans people have, as do the local level sociopolitical contexts within which we live. And so understanding trans and gender diverse people's experiences within and across these different contexts is much needed. And so one of the aims of our current study is to understand how sociopolitical contexts relate to mental health and to exposures to minority stress across 4 states, Oregon, Michigan, Nebraska, and Tennessee. These states vary in levels of structural stigma as well as their supports for trans people. We have a one-year longitudinal study design where we were initially collecting data that baseline data ended last May in 2020. That included in-person interviews, number of surveys, as well as in-person biomarker collection. We then collected monthly data through March of 2021, and we're about to enter a phase with our final interviews and biomarker collection in the coming months. In terms of our methodology and our sample participants, we've got 158 trans-identified individuals in our study, ranging in age from 19 to 70, with a mean of 33 years. The gender identities of our participants include 43 people who identify as trans men, 41 who identify as trans women, and the remaining identify as genderqueer, non-binary, another identity, or something unlisted in our survey. We have a majority white sample with 69% white, and a number of other demographic and identity-based characteristics can be seen in the poster itself. In terms of what we're investigating here, we've drawn on baseline data to look at the relationship between our measures as well in relation to mental health. And so the measures that we've used are perceptions of context, where we're asking participants to rate overall how they perceive the views towards trans people in their state. Participants were also asked to complete the Gender Minority Stress and Resilience Scale, which included subscales measuring victimization, discrimination and rejection, as well as internalized stigma and gender non-affirmation. They also completed a brief resilience scale, the PROMIS depression short form, and the PROMIS anxiety short form.
So in our first set of analyses, we examined whether a variety of variables in our study differed across the states, given the differences that we see in the social political context and the climates of those states, as Zach already described. So the variables we looked at included aspects of perceptions in those areas, how negatively or positively participants viewed their areas in terms of attitudes towards trans people, as well as attitudes in the broader U.S., as well as some other variables around enacted stigma, more overt kind of behavioral forms of stigma, gender non-affirmation, internalized stigma, resilience, and mental health. So we expected that individuals who were living in those less affirming climates would report worse outcomes in terms of minority stress and mental health and lower levels of resilience. And so when we look at the analyses here, we do see that it looks like the perceptions in the areas where people were living in terms of their local area and the state level differed in the ways that we expected. So with folks reporting more negative perceptions of trans people in Tennessee, it's kind of the highest rates of more negative, or the most negative perceptions in that area, followed by Nebraska, Michigan, and then Oregon. So even though there were these differences in terms of the state level climate and local climate, participants did not differ in terms of their perceptions of the broader U.S. climate towards trans people. And we also did not see any differences in terms of the rates of minority stress, resilience, or mental health across those states. On the poster, you can also see a breakdown of the minority stressors across the states. So overall, we see that in general, there are high levels of minority stress across the states. For instance, discrimination in public restrooms was the most common minority stressor. with as many as 70% of participants in Nebraska reporting this stressor just in the past year. This item about restrooms and discrimination in restrooms was the most reported stressor for participants in all of the states as well. So in addition, we also saw very high rates of depression and anxiety symptoms in the sample, with about 65% of our participants reporting moderate to severe levels of anxiety, and then about 45% reporting moderate to severe symptoms of depression. In addition, resilience scores kind of hovered around the midpoint of the scale in kind of the neutral range. So our takeaways here were that participants, in the more conservative states with the least protections, viewed perceptions about trans people more negatively overall, and that across the board, our participants appeared to be experiencing very high levels of minority stress, depression, and anxiety, regardless of the state that they lived in. And part of what we think might be going on here too is that there can be great levels of variation across states in terms of what types of stressors people are exposed to and what types of resources people have. So for example, living in rural Oregon can be very different than living in Portland, and same in other states. So although the state level designations and these analyses did not translate into differences in minority stress, exposure, resilience, or mental health in the materials that we prepared for the poster, we have been examining these questions in slightly different ways in some additional analyses, kind of looking at overall how perceptions themselves relate to these outcomes. And we do see that the more negative you perceive your area to be, the more minority stress people report and the worse mental health. And so our next steps are to look into this longitudinally to see how shifts in social political context change over time and how that relates to changes in mental health and resilience and coping. And so we very much look forward to being able to share that with you all in the future. So thank you for listening to our poster today. We'd also like to send a thank you to our co-authors, Deborah Hope, Richard McCoskey, and Rob Juster, as well as the many people across our teams who have contributed to this work, and also to our participants who have dedicated their time and involvement to this as well. And if you have any questions, my contact information is on the poster, and we also have a link there to our research studies website, so you can find out more information there. Thank you all.